Hey, it's Jessica DaMassa with WTF Health. I'm here at HIMSS Europe and Health 2.0 Europe, and joining me right now I have Bram Van Leeuwen.
Yeah, you
All
did
right,
it,
good.
yes.
I'm getting better at these Dutch names. And he is the lead for innovation for Sanofi,
Belgium,
Netherlands, and Luxembourg. And what was the
Exactly.
acronym you gave me before?
BeNeLux.
BeNeLux, which sounds so much cooler. All right, so it's good to talk to you. So you are very focused specifically on the digital transformation in these three countries, right? In these three regions. So tell me what you're learning, I guess, from your perspective. Who's doing this well, integrating in digital therapeutics and drug plus, and who's not doing so great?
So we are trying to experiment right now. So we're looking around the landscape, what's happening inside these countries and how can we contribute to the system. And what we're seeing right now is that the big question is, how do you implement all those great technology solutions? So we see great digital solutions, but how do you use it in daily practice? How do you make the transition if you're a doctor and already working for 20 years in a hospital?
Right, what do you do?
Exactly.
Yeah.
So what we try to do as Sanofi is we try to support the implementation of those digital tools, of those digital solutions into the hospitals. So
Okay.
we really try to support the organization to make that mind shift.
Okay, and that's really important because I think that's where things are starting to fall apart. It's like there's a lot of really great solutions here in digital health, digital therapeutics, but it's like they're here at these conferences, but they're not in the doctor's office yet. So how are you guys helping bridge that gap? Like what are some of the common issues that you're encountering when you're talking to a physician in a hospital here? What is he saying to you or she saying to you about why they're not giving these to patients?
Yeah, so that's a great question. So 4 out of 5 companies, digital solutions won't make it. They won't make it to the doctor's office, and this is the reason because often they are not well connected into integrated to the daily system the doctor is using, of course. So two screen login, etc.
Yeah.
Horrible.
Yeah.
So that's the first reason. The second reason, they often miss the skills and the competences to use the systems, to use the technologies. Because if you are working for 20 years in a company and your consult is changing because of digital technology, it's hard to adapt.
Right.
It's scary to do. So we need to support the competences as well of the doctors. And the third reason is, of course, the financing. The financing is really hard.
Yeah.
Often the great digital solutions, they don't have a good business model behind it. And especially if the system is not supporting, basically, it's still fee for service instead of fee for performance. That system is really downplaying basically a lot of great solutions out there.
Okay, so that was a great summary of what's wrong. So for any of you startups that are watching, it's like you need to, number one, figure out how to work into the clinician's daily life that as way it exists right now. Number two, make sure that they're trained and understand how to use your tech. And then number three, figure out your business model so that it's not this terrible fee for service kind of thing that everybody's so reluctant to adopt. Okay, so what are you guys doing then? I mean, with the power and the might of a huge life sciences company, you're trying to tackle this. What are you guys doing?
So what we try to do is we try to develop implementation programs. We have done this trick a couple of times already. We know how to implement. So what we try to do is we try to find the right solutions, help them scale up, and build a whole implementation program around those great initiatives.
What's step one for scaling up when you do this? Like when you sit down in a hospital or you're talking to a doctor, like what is the first thing that you need to do?
Yeah, so first thing we need to do is get commitment on all the people around the doctor, like think of the IT department, etc., the board, etc. So we need to get their commitment. If we have that commitment, then we can really start going to start the conversation about, okay, how do we integrate this in your day-to-day practice? So how does your day-to-day practice look at this moment? How is it working? And if we know that, then we can see where can we make improvements on that process with the digital solution. What can the digital solution bring? So often it's not only the digital solution that brings the innovation. The digital solution is the catalysator for a whole different conversation, and it's about process optimization. So,
which is so scary to a hospital, right?
it is hard.
It's
it is hard.
absolutely difficult.
So this, yeah.
I mean, in the U.S., and I'm not sure how it is here, but in the U.S., a lot of times their processes are so regimented and they're tied to medical malpractice, insurance, and all sorts of things. What's it like here? And how do you, I guess, two-part question, what's it like here? And then how do you get past that like reluctance to change a process that has been so ingrained in the way an organization does its own business?
Yeah, it's hard. It's hard. So what we try to do is, if you bring all those different points of view at the table and you map out the process of a patient journey together, often people really start to understand, wait, so this is the whole process. Nobody has the overview of the complete process.
Right.
And when they see the whole process, they start to understand, wait, this is stupid. Why are we doing this way? We can make differences here. So often when people are really on board and engaged in the project, they start to understand that we can make a difference all together, and that we have to change those processes. And that's where the digital initiatives comes in, because they can contribute so very well to all these process optimizations, and that's what we try to do there.
Now, you had said that in your region that you feel like this area that you work with, the Netherlands, Luxembourg, and Belgium, like they've got a better way of doing this and adapting these digital therapeutics or digital drugs better than anywhere else in the world that you've seen. And you told me you traveled like around the world for 2 years checking this out. So what is it about the way that they've done it that you think has allowed them to be able to scale the integration of the digital health into the practice in their hospital systems?
Yeah, so we have a few advantages, I think.
Okay,
It's the unfair advantages.
That's okay.
Basically, in the Netherlands, all the hospitals are basically using one of two patient health record systems.
Okay.
So two basic.
that's easy.
That's easy. It's easy to connect to those. It's easy to integrate with those connections.
Okay.
So that's easy. We have a Ministry of Health which is really engaging with the community on how can we improve healthcare. How can we use digital solutions to make it better and prepare it for the future. So our ministry is very supportive to the community.
Okay.
And they are here with even 200 people.
The professional community or also the patient community?
Both.
Both. Okay.
Both.
So they're
yes.
educating on all sides here.
Yes,
okay, good.
exactly. And well, in the Netherlands, it's becoming normal, patient included. All the digital innovations, we try to engage with patients. We have the conversation. We can improve still, but we are making very good steps in that direction. So I think that helps a lot. And then third great unfair advantage, we have the most connected, we have the best internet system in the whole world. We have the fastest, every household is connected to the internet. 99.5% is connected to fast speed internet. So that's a great advantage. So it's very common to use the internet all over in all age groups.
So your infrastructure is really set up for this kind of thing. So in a system that maybe not so advantageous, like perhaps in the US, where there's a lot of different medical record systems, and then there may not be the government support, or it's very limited, or it's got its own problems. And then also it's like there is kind of a disparity in terms of people being able to access high quality, high speed internet. Well, I mean, what would you say for a place like that? Like if you were to give your best advice, like what is then the thing they should focus on, knowing that they have to work with those kinds of challenges?
Well, then we go back to basics. Start with the patient.
Okay.
If you can add value for the patient and add value for the doctor, and it's clear in the short term and in the long term, because the short term is important, especially if you are the payer. If you make that added value very clear for the short term and the long term, it's easier to implement. Because if people see it, they understand it straight away. If you are at that level, people will follow. So.
Awesome. It's so exciting to hear about at this point the integration of digital health, as opposed to like, what is it? Why should we?
Exactly.
And now we've moved on, which is really great.
Yeah. It is awesome. It's awesome to see. I'm around now for 14 years. In the beginning, I was very busy with explaining what is digital, what can you do with
Yeah.
it. Now, the integration part for us is almost over already. We're talking about, okay, how do you implement it? How do you use it in day-to-day practice?
Yeah.
And what skills do you need for it? What does it mean for a hospital if you have like a few hundred technology guys coming in?
Right.
What does it mean for the buildings you are still using? What does it mean for the competences you are asking from your new physicians that you are hiring? It means different skill sets. And that's the
Absolutely.
conversation we need to start having right now.
Awesome. Well, thank you for kicking this off. We will continue to watch what's going on here in the Netherlands and Brussels and Luxembourg.
Yes.
What was it again?
Belgium and Luxembourg.
Oh, Belgium. Sorry.
It's okay.
What was the cute little acronym?
BeNeLux.
Yeah, I love that. All right. Well, thank you so much for joining me. It's a pleasure to speak with you. I'm Jessica DaMassa with WTF Health. Thanks so much for listening.